Hello and welcome to the Attachment Disorder Workshop. If you've joined me from EYFS, then I would recommend that you go to the specific EYFS. There is an EYFS Attachment Disorder Workshop which I've done specifically for you, although you are very welcome to join us. There are some similarities and there are some differences. My name's Andrew Whitehouse, and to let you know a little bit about me, I'm a TEDx speaker. I delivered a TEDx from Disability to Superpowers. That's available on YouTube or TED.com. You can see my Bamford lecture, Creating Autism-Friendly Audiology Clinics. And I'm also a Bishop Grosseteste University short course provider and University of Lincoln short course provider. I'm a forensic special educational needs and disability consultant. That means that I provide impartial expert witness work in the courts with regard to special educational needs and disability court cases. I'm a keynote speaker. I do observations and I do training. So if you want to be in touch with me, please feel free. You can get hold of me on Facebook, Andrew Whitehouse at People First Education, Twitter, Andrew WSEN. Similarly on Instagram, I'm also Andrew WSEN. If you want to talk to me on LinkedIn and connect with me, I'm Andrew Whitehouse with a load of letters after his name. And I'm Andrew at peoplefirsteducation.com on the email. And there's even an online booking form on the website. So if you want to speak to me, I've got to be the easiest person in the world to get hold of. So let's talk about attachment disorder and my story with attachment disorder and how I got involved with attachment disorder. My original connections with attachment disorder were many years ago. I'd been doing some work for a school in the East Midlands, and I've been doing things like social story work and work on ADHD and things like that. And the head teacher got in touch with me and said, I've got a conference coming up. I'm doing a workshop on attachment disorder, and the attachment disorder specialist has dropped out. This was possibly 15 years ago. And I said, I'm really sorry. Attachment disorder is not one of my subjects, and I can't. It's not one of my subjects, and I don't feel qualified to deliver this. Anyway, he basically said, come on, you can do this. You know enough about this. You've worked in enough places, schools, etc., and you've seen this stuff. So I did about a couple of weeks really heavy cramming. And what I found was the similarities between attachment disorder and autism were huge, really, really huge, but the causes were different. So that's how I got involved in attachment disorder. And really, it consolidated the fact that when we're looking at how people are presenting, what we actually should be looking at is why they are presenting, not how they are presenting, but why. So we've looked at fetal alcohol spectrum disorder, and we know that people with fetal alcohol spectrum disorder can present in the same ways as autism and ADHD, as can attachment disorder. But what we're really looking for is the reasoning behind it. So in fetal alcohol spectrum disorder, it's brain damage. In attachment disorder, it's attachments in early years. So what is attachment disorder? Attachment disorder is caused by trauma and loss. This trauma and loss can be pre-birth, post-birth, and early years. I'm going to add to that as we go along in adult life. Most things you read will tell you it's pre-birth, post-birth, early years. I would argue you can get attachment disorder at any time in your life. So let's do a little bit of digging in here. Attachment disorder really is the difference between when things go right and when things go wrong. You've got the picture of the man on the screen. He's about to step on the banana skin and he's going to fall over, just like in the Beano. What you've got there is the fact that he's probably having a perfectly normal day. Everything's going well for him. He's, well fed, he's had a good morning, he's had a good breakfast, etc., etc., etc. I'm rambling, but the point is, he hasn't seen the banana skin. All of a sudden, things are going to go wrong. He's going to fall over. He's going to hurt his back. He's going to drop his bags. Everything's going to go wrong for him. And that's the difference between attachment disorder and not attachment disorder. When things go right and when things go wrong. So let's have a look at those. When things go right, all you're really looking for is adequate parent giving. Adequate parent giving more than adequately most of the time. So adequate parenting and adequate caregiving are behaviour development, nutrition, health, daily care, play and learning, safety, connecting and sleep. All the things that we all need to get us through the day. And that's how we are getting things right. Now, the point when we say adequately, what I'm saying is that you don't have to be the perfect parent. It really is just about doing the best you can and getting most of the things right most of the time. When things go right, we get babies and children with good self-esteem. We get independent, autonomous children. We get resilient children. We have children who can manage their impulses. And there you can see one of the connections with ADHD slightly creeping in. Impulsive behaviour is managed. When things go wrong, impulsive behaviour is not managed, and therefore you get that kind of connection with ADHD. Long-term relationship skills are good, yeah, not just in our partner relationship skills, but with people that we work with, the people we go to school with, whatever. You know, we can build long-term relationships with those. Adult authority relationship skills are good. We understand that it's probably a good idea to listen to teachers, the police, and the people who run in our country. We have positive social skills, and we can develop trust, intimacy, and affection. We also have a system belief. So our system belief may well be family, self, society, whatever it may be, but it's there and we have a belief in that and we can trust in it. Okay. Furthermore, when things go right, we have securely attached babies and children. They can express empathy. They can be empathic. They know when something's not right for someone else and they can help with that. They can also express compassion for their fellow human beings. We can present with a conscience. We know when we've done something wrong. We feel bad about it. We do something about trying to put it right. Our behavioural performance is good. We're not known as the sort of person that goes and causes problems around the town, and our academic success will meet our potential. And that's, again, when things go right, securely attached babies and children. However, we have things going wrong. Now, the sort of things that can go wrong: pre-birth stress. If the mother is in a stressful situation, this could be health, this could be relationships, all sorts of things. I'll go through a few. So we might have self-harming, could be one. Domestic violence could be another one. The mother's getting hurt. Alcohol, drug use, misuse. And at this point, I'd like to refer you to the fetal alcohol spectrum disorder workshop, because obviously there are other knock-on effects from alcohol and drug misuse. And I think this would complete the picture for you. Parental illness and medical complications in the womb. This is when things go wrong in pre-birth. However, post-birth, we have similar things. Post-birth stress are one of the risk hotspots. Parental illness again. Premature birth, and there's a lot of research out there to say that premature birth, that may lead then to the baby being taken away from the mother if the baby's ill. that can have a damaging effect on attachments. Medical complications during birth, so something like an emergency cesarean, a forceps delivery, those kind of things can be a risk hotspot for attachment disorder. A bereavement, particularly if the mother passes away during birth, infant disability, and neglect. Okay. Other risk hotspots: abuse. Abuse falls into many headings. I would say emotional, sexual, physical abuse. Home instability. I'm going to talk more about that in a little bit. Poverty, abandonment, mental health in caregivers, and multiple homeschool placements in early years. And that could be for a variety of reasons. That could be linked back to poverty, where parents or parent or caregivers or caregiver are having to move around a lot. We also, you may find difficulties in military families where they're having multiple placements. Even something like people who are property developers and they're constantly on the move. And this can be a risk hotspot. It might not be, but it can be. So here are a few examples of how children express the effects of insecure attachment. So this is the things that we are kind of looking out for. And I would say if your pastoral systems are in place in school, you're probably looking out for this stuff anyway. And so it's not really all about the labeling, it's about the cause behind it. But a poor sense of self, so an impoverished view of the future, having very little in the way of hope, not understanding the difference between right and wrong, constantly being agitated on the edge. And so, those people, they're on a little bit of a knife edge. They're always a bit cautious how you deal with them. Transience, being a bit out of it for no known real reason some of the time. Fidgety. Now, fidgety is an interesting one because there's lots of reasons for people being fidgety. They may have a nervous disposition. They may be ADHD. So it's not, none of these are really cut and dry, but they're things that you're looking for as a whole. Overexcitable, overreactive aggression, inappropriate sexual behaviors. This is a tricky one because this could be to do with attachment, or it could be to do with the fact that these children are exposed to things that they really shouldn't be exposed to in the home, that are not appropriate for them. So again, something to be wary about, but it might not be attachment, it could be something else. Okay, how children express continued insecure attachment: verbally abusive, lack of self-awareness, and unable to describe their feelings. These are very tricky things because again, they could be representative of numerous things that go on in the environment, perhaps in the home environment or the school environment, around friends, relatives, etc. But all sorts of things. And this is where we would want some kind of therapeutic professional to be involved in order to help the child to unravel all this kind of stuff. How children express the effect of insecure attachment: we'd be looking at relationship skills, trusting others, making, keeping friends, understanding the feelings of others. If I do this, what is it? What is this likely to have an effect on with other people? Well, in autism, we have a similar thing. It's called theory of mind, whereby the person with autism doesn't have that ability to consider the feelings of others. We can have learnt empathy, but but that's a slightly different thing. That natural empathy, that understanding of other people's feelings, is absent in autism. Well, it may well be absent in attachment disorder as well. Social communication, knowing how to communicate with people appropriately, over familiarity. And you will meet people like that. You think, they're a little bit too friendly, they're a little bit too much. Trusting adults, heightened sense of justice, and sensitive to respect. And there we have a little connection with gang culture, which is all built around respect for environment, respect for the hierarchy in gangs and things like that. And also we know that people with attachment disorder are vulnerable to getting involved with gang culture. Okay. Other ways that insecure attachments are expressed within relationship skills: lying, compulsive lying about things all the time, very poor eye contact, very poor physical contact. Well, you know what I'm going to say again, don't you? We're back to those autism connections. That a lot of people with autism don't like to be touched. A lot of people with autism don't like that physical contact, and they don't like that eye contact, and they find it very difficult and intrusive. Can't explain their actions. I've done something and I don't know why. This could, of course, be again there in ADHD, when you have impulsive behaviors, and you say to a person with ADHD, "Why did you do that?" "I don't know." And quite often the response of the adult there is to get agitated and say, "Of course you know, tell me, why did you do it?" Genuinely, they don't know. And this is the same in attachment disorder. Very superficial with people. Lack of remorse. We've done something, so what? Big deal, I've done it, who cares? This is not appropriate social behavior. Very clingy. Expressionless faces, and we're going back to Asperger syndrome there, and autism, where facial expressions aren't always clear, and a difficulty having fun. When we get to school, places where they will struggle will be the changes to routines, organisation problems, concentration problems, progression problems. They're not moving along in the way that you had hoped that they would move along, and therefore you're not getting you're not getting the age appropriate progression, and also ability appropriate progression. You might have speech and language difficulties. Now let's really dig into speech and language difficulties. Speech and language problems, what we're talking about there is possibly heavily related to attachment. We now have what I've discussed in 2 or 3 of these workshops, what I call the iPad generation, whereby we have young people who their parents or their caregivers are not communicating with them. They're putting them in front of screens, whether it be the television screen, whether it be a tablet screen and what have you. And from a very early age, these children are using these things very proficiently, don't have a problem with this, but they are not a substitute for human interaction. They are a supplement to human interaction. And of course, the temptation is so great. If I think about my television at home, I've got BT View, I got Amazon Prime, I got Disney, got Netflix, and all manner of other things, including games and all the rest of it. And so very, very easy to put a child in front of this and say, there you go, get on with it. But of course, knock-on effects to speech and language are huge. And I'm getting called in quite a lot for that kind of stuff, and social skills related to screen, over too much screen time. Motor skills, fine and gross. So the small motor skills might not be as well developed. They're not very good at doing little things, little activities. And they might also struggle with gross motor skills. Big things, climbing, running, jumping, kicking, ball, something like that. So lots of stuff in there. We also have inconsistent responses to rewards and sanctions, that they may respond really well to a reward on day one, but they may then think, you know what, I've let that person in and I didn't really want to let that person in. So that person comes along, gives them the same reward on day two, and they go, I don't want it. What are you giving me this rubbish for? You think, well, you liked it yesterday. Yeah, I liked it yesterday, but I don't like it today. And it's very much a case of cutting off your nose to spite your face. But really, what they're trying to do is not let that person in. Okay. We need to work closely with children who've experienced trauma and loss. People can be stuck at development stages because of their early experiences, and they need a development boost. You're going to have to work hard with these children. These children are vulnerable, they're emotionally damaged, and psychologically insecure, and you're going to have to work with them to build, starting with their sense of self-worth and their self-esteem and their well-being. That's the first part. You can't actually work with the academic side until you get those other social and emotional things in place. So that's your starting point for these kids. And here we go. I mean, if you can see on the screen there, the relationships originate in three places: home, school, community. And it is all three of those, but you may not be able to put all three of those in place. So, you know, for example, let's take the easiest one, community. Not easiest, but widest one, community. It might be you have a child that lives in a very difficult area. You might have a child that is in a family that is subject to racial abuse because they are a minority, or religious abuse because they are a minority in that area. So community might be a difficult one. It might be a community where there's a lot of crime. Again, very difficult with building good relationships in an area like that. It could be at home. It could be difficulties with the parents, and we've put in everything we possibly can, but it's really just still not working out for them. And it could be at school, and you think, oh no, we're getting it right at school. But what about relationships with the children? What about relationships with the environment? And so it is quite a tricky one. And we do want to be, working on all three of those. What you may find, though, is all three of those is not possible, and that you might only be able to work with two of those, or even one of those. Nonetheless, that's the aim. That's the major goal. You've just got to work with what you've got. You will keep putting in those interventions for home and community, but you might just have to work with what you've got. Now, school, when you consider school, a child spends more time in school than they do at home, that's for sure. And school has a massive, massive role to play. They're in school for a significant amount of time. When you think about children, when they go home, how much of their parents do they see? Especially younger children, they might be in bed by 7 o'clock. They might be in the garden all weekend, or out with their friends, or visiting relatives, or, you know, if parents aren't together, they might have split time over weekends. So, you know, school is the big player here. And so school needs to think really carefully about progression plans and emotional social frameworks. And they need to take into consideration, okay, we've got them in school. We can do a lot of work here, but we need to be thinking on the other side of things, what's happening out in the world of home and community. We need to be able to differentiate social and emotional tasks. So we don't want to put unreasonable pressure on children. That might be something like doing something very simple like testing. Testing might have to take a new form, a different form. Might be something like getting the child to do presentations. That might well be too much for them. Putting them in positions of responsibility, again, might be too much for them. If they've experienced trauma and loss, they're, as I've said, I've used the same words before, emotionally damaged. Putting too much on them just really might not be the thing for them. So we need to adapt our practice to support and include children with difficulties with attachment and complex needs. Now, two main tasks for the educator: provide an optimum learning environment and engage children in learning. Okay, you've got two jobs. This is what you've got to do. Now, in fact, let's go back there a bit. Actually, I'd like to talk a bit more about that. Engaging children in learning. You might find yourself in a position whereby you're trying to engage that child in learning, but is that child ready to learn? That actually you might be really trying to get the optimum learning environment in place before they're ready to learn, or more than that, it might be that you just want to get them engaged with the venue, engaged with the place before it's even an optimum learning environment, to get them into the room, into the building. So when we go with things like school refusers is quite a good one, because it's quite an interesting one, because one of the pieces of advice I get called in for a lot of school refusers, one of the pieces of advice I give is, don't expect them to do much in the way of learning. Don't expect them to do much of engaging with school activities. Just get them in the building. Get them in the building. Set small targets. Small targets like, okay, you've got to come into the room and you've got to spend 10 minutes in the classroom without even any learning. And then the rest of the time you might be in an inclusion room or in a nurture venue or playing games or what have you. And I know it sounds a bit wishy-washy, but actually you can then build on that, build it. And where the problems start is when you're expected to build that too soon. Yeah, you want to get them in, engaging. So we'll look at that as well. Okay, you need to use supportive scaffolding and interventions. And so supportive scaffolding and interventions is, remember that you need to look at their emotional development age as well as their age. If they've not had that input in home and community, and indeed even in possible school settings, then you've got to put that in for them, and you've got to take it into consideration. The children that need the most love ask for it in the most unloving ways. View behaviour as communication. That's hugely important. Don't look at what they're doing, look at why they're doing. Don't differentiate by outcome. That I would have thought was an obvious, but actually I'm seeing less and less effective differentiation as I'm travelling around, and I'm trying to get that back in place, one school at a time. Get to know the child, get to know their needs, their interests, their aspirations, and be explicit. Don't mess them about with implicit language. Be explicit. Talk to them in a way that they understand. All the tasks, all the expectations should be developmentally matched, both socially and academically and physically, challenging and achievable. Challenging and achievable. How do you get that? Well, again, you might well say, right, okay, let's look at challenging. Should every task be challenging? You might want to have a certain amount of tasks for that child that are not too challenging, just to give them a good feeling of achievement and self-esteem. But I wouldn't want to be doing that all the time, because you have the obvious risk of them getting bored. But challenging, yes, most of the time. Achievable, we don't want too many failures. We don't want too many things going wrong. So achievable, definitely, if at all possible. Now, slipping back a bit, when babies are born, they rely on parents or caregivers to protect them, care for them and look after them and their emotional and physical needs. That's what we want. Okay. And what we find is that often this is not achieved. So having these needs met allows to form a bond with their parents, or attach as we call it. Forming this attachment helps children learn to love, to trust, to regulate their emotions, be aware of other people's feelings, and develop healthy bonds in the future. And that's what we hope to see in our school settings with the children that we are working with. However, this may not always be the case. If a bond isn't formed, children develop what we call attachment issues. And one of the most well-known is attachment disorder. Now, it might be that that child has felt abandoned, isolated, or uncared for. It could be any number of things. It might well be that they don't hold any blame, or they don't hold any finger pointing when it comes to the reasons behind this. They just feel like that, and their feelings are not good, and so they're presenting in these attachment ways. So when we look at it, the reasons behind these experiences can be very, very complex. But for a child, all they understand is they can't depend on other people. This is where you come in. This is where you come in. You have to be the dependable one. And so what I'm going to do, I think we'll have a little bit of a workshop here. I'd like you to stop for a minute. And I want you to think of a few things that you could do to make that child believe that they can depend on you. So we pause now, and we'll start up when you're ready to go. Okay, welcome back. I'm hoping you're going to be able to send over some ideas to me, but some of the things that I would be thinking about would be consistency, would be truthfulness, would be reliability, would be spending time with that child, asking them questions about themselves, sharing your own emotions with that child, some of those things. If you've got any other ideas, I'd love you to send them over to me, because everything is circular. Everything you give me gets fed, or nearly everything you give me gets fed into the next cycle of training events. So please do feel free to share this stuff. You will be welcomed with open arms. Lack of attachment can lead to behavioural problems. Behavioural problems in the school, behavioural problems in the home, and then in the wider community, causing difficulties around the town. It may affect relationships, and that would be friendships, as well as your personal partner relationships, and it may affect social bonds. But it has a knock-on effect with pretty much everything. Okay, sorry, excuse me. Okay, right, just went on a little bit fast there. Okay, this is directed task number 2, and what we're going to be doing, I've got 2 videos a little bit like this, where the child, no, I haven't, I'm sorry. I've got 1 video like this where the child is discussing their attachment disorder with an adult. If you've got the electronic PDF handout, then you should be able to just click onto the link on your screen. If you've not got the electronic PDF handout, you can search it on YouTube under reactive attachment disorder, or you can write to your old pal here, email your old pal, send me a little message, and I will send you the link. It's a really good piece of video, and I think you'll find it quite enlightening, the way this child talks about his difficulties with reactive attachment disorder. Welcome back. Hopefully you've watched the video now. If you've not watched the video now, have a little look at it later. So you won't lose out this next section by not having seen the video. So what is attachment disorder? It's a specific disorder of mood or behavior. It's the inability to form social relationships due to a failure to form attachments at a young age. Typically affects young children. Left untreated, it can apply to school-age children. And I've added this, adults. A child, I love this image here, a child with emotional, physical needs, those needs are not met, may grow into a non-trusted and detached adult. That's just common sense. That's just out there, isn't it? And so I want to talk to you about a case that I worked on privately with a person where this person, as a young adult, is father left and never to be seen again, and then mother passed away, and then this adult male in his teens, late teens, became the carer, legal guardian for his sister, and therefore, in essence, he was his sister's dad, and he developed what I would say were quite intense attachments to music and record collecting, and these attachments are quite far-reaching actually, and he would have put those in priority to pretty much anything in his life. Sorry, I forgot to say, after his sister moved home. Sorry, once his sister moved home, he developed this attachment disorder, and he would put this even to the point of getting into financial difficulties and all sorts of things like that. So left untreated, it can apply to adults, and you can see the build up there for this person. So apologies for getting myself all wrapped up there. True number of children affected with attachment disorder is unknown because many families don't seek help. Why don't they seek help? Well, trust, belief in systems, belief in your social community, belief in authority, etc. Whole lot of families out there think, oh, good grief, if I tell them, are we going to be in trouble? You know, that sort of thing. So it is true. Many families don't seek help when they need it, and this makes it difficult for us, because if things are not identified early enough, it makes the education system, it makes it difficult for us to put interventions in place. So some social difficulties. A failure to form attachments in childhood may cause social difficulties in the future. You may find it hard to understand others. You may be wary of others' attempt to socialize. You may develop social anxiety. Social anxiety is a form of anxiety where people struggle with social events such as parties, chatting to people in the street, making telephone calls, all those kinds of things. Again, I have put some workshop work together for social anxiety, so that should be out there for you. Difficulty speaking to others is a big one in social anxiety, and that might well be presenting in awkward other social behaviours and behavioural behaviours. Attachment disorder and issues fall on a spectrum, so mild problems can be easily addressed. A little bit of therapeutic interventions and a good program of therapy can be really helpful with that. More serious condition is reactive attachment disorder, which I've given you the video on, that I'd love you to have a look at. And then symptoms can vary in severity from person to person, and they may well be either misdiagnosed or certainly resemble closely other disorders such as autism or ADHD. Okay. Serious attachment issues. The most serious attachment issues occur following neglect or abuse. There's the two types of reactive attachment disorder, that's inhibited or disinhibited. And so to discuss, sorry, excuse me, there we go. To discuss the inhibited reactive attachment disorder, the extremely withdrawn person, that they don't want to be out there. They might even be agoraphobic, not wanting to go out. They're emotionally detached from people. If you try to help them, they might push you away, not physically, but just repel you in that way. Resistance to being comforted and help and having help. They might well be hypervigilant, over-vigilant to their surroundings, although they're unlikely to react to what's going on around them. So it's difficult to see that. Again, that hypervigilance is quite often present in ADHD, and that emotional detachment quite often present in autism. And we believe that there are approximately 25% of people with ADHD are autistic, and therefore it would be quite within the realms of possibility that this person with attachment disorder might be misdiagnosed as ADHD comorbid autism. Disinhibited, on the other hand, are likely to seek comfort from anyone. Very, very open people. They don't care whether it's your parents, strangers, caregivers, teachers, doesn't matter who. They're going to do that. Very dependent on other people, very needy people, and they often act younger than they really are in order to create that persona of someone who needs help. Now, in attachment disorder, there are treatments. There are two aims. One is to ensure a safe environment. Is there a place you can go to and feel comfortable, safe, and happy? And this is obviously most important when there's been abuse or neglect in the home or in a home. The other aim is to help the child form a healthy bond with appropriate caregivers and deal with any residual problems. Now, we've used the word appropriate in there. Appropriate caregivers is key terminology, because we don't want them forming bonds with just everybody, but I am going to talk about forming bonds with teachers. Lots of different therapies out there: family therapy, play therapy, individual therapy, and in order to get to the root of things, there's quite a lot of work being done on individual therapy and play therapy with puppets and communication methods of that type. You need to be realistic with expectations with attachment disorder, and so you might want to just pick 3 expectations for them instead of a whole load of expectations. With every condition, neurological disorder, traumatic experience, I always say, trim down your expectations with people. Don't expect too much of them. For example, one of the examples I give is dyslexia. If I'm running a dyslexia course and you may get 100 strategies for dyslexia to help a young person with dyslexia, what do you think's going to happen if you go back to that child and say, here you go, Julie, here's 100 strategies to help you with your dyslexia? What's the average 8, 10, 15-year-old going to say? My goodness, I can't do all that. So you've got to be, again, lower your expectations, or not lower them, minimize them. Just try 2 or 3 expectations of that person and give them manageable things to work with. Ensure that you're focusing on every achievement. Doesn't matter how small. Celebrate all successes. If that child's done something, they've done it well, brilliant. Ensure that you celebrate that. Be patient. Be very, very patient with them, and tolerant and calm. Don't escalate. Remain patient when setbacks occur. If you're calm with that child, then you're not creating but consolidating that sense of security that you've worked so hard to build up with them. Sense of safety, these children, they crave the most, and this is hard work. And the reason it's hard work is they often repel against that. it's partly because they're testing you to see how trustworthy you are. So you've got to be the one to prove to be that trustworthy person. Children with attachment disorder experience high levels of stress. Keep stress to a minimum. Communicate with your colleagues. Stay positive. And if they feel discouraged, if they see you feeling discouraged, they're likely to feel discouraged. So you've got to put your best big smiley face on there, and be positive about as many things as you possibly can. And also, setting limits and boundaries can be really helpful. And what I mean by that is that they can work well within limits, well within boundaries, because they need to know what they can and what they can't do, because they may not have had those social interactions when they were younger. So setting limits and boundaries can actually be a comfort zone to a child with attachment disorder. And in fact, consistent and fair boundaries make the world predictable and less scary. Setting limits helps them to understand what is expected from them. Fair consequences will instill a sense of control. And in addition to all this, if you've got it wrong, be big. Be the person to say, I'm really sorry, that was my fault, and own up. Be available immediately after conflict and own up to mistakes. Because we do fall out with these children. It's very, very easy to do, because they can be quite difficult to work with. I want you to use your visuals, visual communication with these children. I use this slide a lot just to remind you how important visuals are. Visuals are processed 60,000 times faster than text. Are they? I don't know. Is this true? Who knows? But I think they're processed a heck of a lot faster by most children, and therefore do use them. Use your social stories, use your emojis, use your 5-point scale, all that stuff that you know that I love to work with. Remember the power of modeling. Best thing you can do is show them the right way to behave, show them how you behave, and they will hopefully mimic that. Be creative with communication. Don't just use your voice, use your visuals. And again, the standing joke probably by this point through all these workshops is visual timetables. They can set a scene for comfort zone, predictability, reliability, and they're one of the best behavior management tools that you can probably get. Okay, I'll put in place. And there you go, just to remind you a few nice vertical visual timetables. Just to check, let's set a little task here. This will be fun. This is for some of you who've seen some of the other workshops. Visual timetables. Here's a question. Send me an email or a DM on one of the social platforms. Why should they be vertical? That's just a little revision task for you. We need to facilitate supportive scaffolding across the curriculum, and we need to differentiate actively. How can we do this? One of the ways you can do this is to look at special interests. Looking at special interests, it's a gift on a plate when it comes to attachment disorder, because what you're actually doing is, if they're fascinated by something, that's a way in that you can use to get to know that child. And so using the special interests is a really good one, because you've got something there all in place and you can work around that. And again, quite honestly, I've even pretended to be interested in things. No, I'm sure you all have. Many, many times I've pretended to be interested in things. Two of my big fakes that I've given is Doctor Who for a child with autism that attends a youth club that I attend. I happen to say that I enjoy watching Doctor Who, and I do, always have done, but with this child, I had to pretend to be very, very obsessed with Doctor Who and want to know every single tiny little minutiae, because that was important for him. So I had to really extend my Doctor Who knowledge for him, which was very enjoyable, but it took me to a place I wasn't expecting to go. Another one was American football, and I had to actually pretend to be a fan of American football. I had a tiny bit of knowledge, having tried out a couple of times for an American football team in the 80s, and it turned out that I wasn't anywhere near tough enough to play American football, but I gave it a go. Simplify tasks in emotional and social situations. Break down your tasks into manageable bite-sized chunks. Like a lot of conditions, you might be faced with an I'm not doing it scenario, and you want to be able to get that child to achieve very, very slow steps, take it nice and steady, and understand that what you might see as a very small challenge might be a massive challenge for that child with attachment disorder. Hey, a heck of a lot of other children as well, autistics, ADHD, PDA, all those things, PDA being pathological demand avoidance syndrome. Support differentiating between relationships. Explain to those children, show those children, workshop those children, get your puppets out. That, you know, you can't have the same relationship with everybody, that it's different with different people. And so you might need to translate social situations into something that they can understand a little bit easier. Because if they've learned something that works, they may well try that everywhere, and it might not be the case, and then it might be. And that's the bit that you've got to translate for them. Support when it's okay to talk, but who to talk to, what about, and how far into your own personal life you can go. Support in knowing how to connect in ways which are healthy, safe, and appropriate. Hugely important, because these kids can make mistakes because they've not learnt those social skills early on. Discuss how you will connect with them. You can even set in the guidelines. This is going to be our relationship. This is going to be our friendship, and this is how we're going to do it. And translating states, feeling, and behaviours by thinking aloud. That's a really good one. So, oh, I wonder what I'm going to do here today. I wonder, oh, I feel a bit worried about that. Perhaps I should do this, 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 and this. Thinking aloud, very, very good one. Okay. Be explicit about what's happening and why, particularly if voices are raised. So if there's something, just nearly dropped my keyboard there. So if something going on that's a little bit scary or a little bit loud, or could be perceived as being, you know, a little bit too much for these children to deal with, explain to them exactly what's going on and why. And you'll find that they will, again, that will accelerate their feeling of trust towards you. And so particularly if voices are raised, simplify expectations into chunks. Yeah, I just want this, I want, you know, and don't build on it. Don't expect them to remember multi-staged commands and requests, particularly if they're ones that suffer with stress quite a lot. Be cautious of making assumptions about their understanding. They may have missed out large swathes of their social learning, of their academic learning, and particularly if you've picked that child, they've come from another school, another environment, you know, it might be that they're really not, they're not ready, and they don't have for the task in hand, excuse me, waffling again, and it might well be that they are that they need that little bit of a leg up, little bit of a academic, social, emotional boost to their understanding. Provide structure for children to organise their thoughts. Brilliant. Use your visual stories, use your 5-point scales, use your comic strip conversations, all that stuff. And if you want to extend beyond school, you might want to support them in beginning extracurricular activities until they become integrated into routines. So you've learned how to do home, you've learned how to do school. Let's hope you've done those things. That's 2 very big expectations. And then we say, and now you're going to join the Cubs or the Brownies or the Beavers or dance class or whatever. And, you know, that's a whole new thing again. And so you may need to support and integrate that. Help prepare them with appropriate equipment. So if they are going into some kind of extracurricular thing, the commitment they need, you know, help them sort that out. help them organise themselves with whether they've got things. So if parent caregivers sent them off with karate kit in the morning and teachers got them all day and they're off to karate as an after school club, on site, on site, then, it might be helpful for a teacher to just be part of that and say, have within the teacher's timetable, oh, remember Yasmin has a karate class tonight, and just, Yasmin, if you got your karate kit, do you want me to just check that for you? Remember the power of modelling, as I've said. Don't just use your voice. Regularly check understanding and comprehension and set good examples. I'm afraid you've got to be squeaky clean. And you also have to think through situations before you put them in place, whether it's a social situation, academic situation, really doesn't matter which it is. Anticipate whether children might need support to avoid failure, and be ready. When you've done something that you feel really, really good about, let them see your pleasure. They can then start to learn satisfaction and pride in their own achievements. They might not know, right, they might not know what pleasure looks like. They may not know what celebration looks like. They may not know how to express the feelings that they've achieved something great. So when you've achieved something, show them what it looks like. Show them how you feel. Even be that little bit over the top if you can. Relating to the child, the language we use all has to be considered, and we have to consider their emotional, social tasks and targets. We've talked about that quite a lot. You've got to be that person. Okay, I'd like to talk about this a lot. So being that person means that I'll give you an example. I was doing an observation in a school. It was an informal observation. I wasn't planning to do it. I did a workshop in a school in a morning for a group of schools, a cluster of schools and parents about attachment disorder. And we did the morning, and a load of people came along, and it was quite a little room, and there were about 100 people, and it was a good workshop, went very well. And at the end of it, one of the teachers from the school where I was actually delivering the workshop came up. He said, could you come and have a look at a child for me? Well, I'm not very good at resisting that kind of invitation, so I said, okay, yeah, I'll do that. And so I went in the classroom and I observed the child, and it was one of the most interesting attachment issues as far as an anecdote I've ever seen. So most children, if they're misbehaving, I would say this kid was maybe 8, 9 years old, maybe even 10, and most children, when they're misbehaving, they misbehave when the teacher looks away, right? But this child misbehaved when the teacher was looking at them. And when the teacher looked away, they'd stop misbehaving. And, and of course the teacher didn't know that. They think they're misbehaving all the time because, when they're looking away, they can't see it. So to me, that was a very obvious case of an attachment issue. That child was trying to get the attention of that teacher. That teacher meant quite a lot to that person. He was a male teacher and he was quite young. I think he was newly qualified. So we had the meeting afterwards, had a chat with the teacher, and I basically had to break it to him that he'd got a new best friend, that this child really, really liked him, and that he was trying to get his attention, but he didn't have the social and behavioural knowledge to know the right way of getting the attention. So what the position we put that child and the teacher in was this. Teacher now has to be that person, that point of contact for that child. He also has to teach the child the difference between good attention seeking and bad attention seeking, good behaviour, bad behaviour, and the fact that the child needs to know that it's better to be noticed for good things than for bad things. Okay, I'm making this very, very simple. Please, nobody take offense that I'm using the word bad. I'm just trying to keep this simple. And so we can teach that child. One of the ways we can do that is make teacher that child, give them responsibilities, give them activities with the teacher. This teacher, if you've got, we were talking about appropriate relationships. I think we can do that with teachers in school. I think it's quite appropriate to let that child have that point of contact and have that just that little bit extra where they are working with that teacher to build their future social skills. I think that's a good one, and I would definitely recommend that. So be that person. All right. Okay. Moving along a little bit more. Child's communication is communication. So child's behavior is communication. I've said this earlier. All behavior is communication. So you want to look behind it. In most of the times in attachment disorder, the behaviors are fueled by anxiety. We need to focus on the cause of these behaviors. Why and not what. Traditional rewards and sanctions may not work. So you have to think a little bit out of the box there. Better to spend time with the child building a relationship, most definitely, getting to know the child. Be cautious with the language you use. So some things that aren't helpful are be kind, calm down, concentrate and be patient. Generically, people don't like being told to calm down. It's the one thing guaranteed to rev a lot of people up. And it's also not clear. You need to be clear with what they need to do to meet your expectations. So instead of be kind, say, something like touch others gently. They feel uncomfortable when they are pushed. Talk quietly to others. It shocks and hurts people when someone shouts in their ears. If you see someone on their own, ask if they'd like to join in. People can feel sad if they are ignored and moved away from. Smiling at people can make them feel happy. People can feel upset and confused if they're snarled at. Nice, explicit communication. Here's a metaphor for you. This is the person you have to be, and that is the fragility of the person that you are working with, despite the fact that their behaviours and their actions might not quite look like that. Thank you for listening. I've set you some directed tasks, particularly the video. I would like you to watch that video and a couple of the other activities within the workshop. Please feel free to share those with me, and I look forward to seeing you on the next work.